representing the city of Suffolk, and I also chair the Strategic Planning Committee. I have the responsibility of presiding over this public hearing, so I'll take the first step, which is to call the hearing the 2018 Senior Services of Southeastern Virginia public hearing to order. Now, I would like to welcome you. We certainly appreciate your presence, and I also like to welcome those who are viewing this public hearing via Facebook. We do this annually, and just so that if you're hearing this or attending for the first time, I just want to go over the process and the purpose and the agenda so we know how things are going to flow. First of all, the annual public hearing is presented by Senior Services of Southeastern Virginia to give you our update to our area plan. That plan covers the period of 1 October 2018 to 30 September 2019. You normally will come in, sign in, and then sign up to speak. And those who are viewing over Facebook, you send your questions and we will publicize those also. Now, the public hearing, again, is conducted either by the chair of the Strategic Planning Committee or for the chair of the Service Advisory Committee. So today I will be conducting the public hearing. It is always held normally in the month of May or June, depending on the area plan preparation schedule. The public hearing is always held here, Senior Services of Southeastern Virginia main office here at Center Avenue in Norfolk, and it's always a public hearing. What happens after the public hearing, for those people, for example, we advertise this public hearing through print media. We also do our website, social media, and word of mouth. Now, if there are people who you believe should be here and they, for some reason, were not invited, we would like to know that so that we can continue to increase our scope of bringing people to our public hearing. Of course, the focus would be on seniors and their caregivers, stakeholders, partners, and military veterans. After the public hearing is held, there's a 2-week period where we can continue to get written comments based on the briefing, the update. So we will continue to get those. They become a part of the minutes, and then we use that as a part of the area plan and update, and we're required to do this by regulation. Now, the agenda will flow like this. I have just welcomed you, called the meeting, the public hearing to order. We're going to have a presentation by our CEO, John Skirving. I also would like to say that this will be the last public hearing that John Skirving will attend as the CEO. He is retiring effective August, and I would like for you to give him an applause for his 28 years of service. Okay, so I will let him go on and give you the presentation, and again, once that is through, then we will open the floor open for comments, feedback, not only by those that are present, but also by those who are viewing this session via Facebook. Thank you.
Good. Thank you, Sheila Mason. Give her a round of applause, please. Sheila is retired military and has been a driving force on our board to help senior services become more responsive to older veterans. And so I really appreciate her actually employing one of our core corporate values, which is courage, because I have to say this is our very first time using Facebook Live, and so it takes a lot of courage to get up there and do this. So my name is John Skirvin. I am the CEO at Senior Services of Southeastern Virginia, and I do appreciate the opportunity to present the update to our area plan for aging services for our funding year 2019, which actually begins on October 1st. We have slides that I'll be using to communicate. Folks on Facebook probably can't see these. However, if you would like a set of the slides, you simply need to contact us and we will send you those slides. In the United States, there are actually 622 area agencies on aging. In Virginia, we have 25. We were created through the Older Americans Act, which was originally passed in 1965 and then has been reauthorized over the past several decades. Each state has a state unit on aging. Ours is the Department of Aging and Rehab Services. And in the United States, 55% of the area agencies are government entities like county offices on aging, such as there are up in Northern Virginia. And then the other, about 39% of us are private nonprofits, and as is Senior Services, a 501c3 nonprofit. And then the other small group of us might be a community service board or another kind of organization. There is a website where you can really get a great picture of the breadth and depth of area agencies in the U.S., and that's at the n4a.org website. Today, as Ms. Mason has said, is an opportunity for you to input on the needs of older people. Tell us what you see, and for us to present to you our priorities for the area plan for aging services, and that also to get not only what you see as needs, but what you think are priorities. One of the real values of area agencies is that we're local, that we really respond to the needs of our individual communities. As you might imagine, in Virginia, in Bristol, Virginia, the needs are much different than they are here in Norfolk, Virginia. Our vision as an organization is that we are a community that empowers, respects, and values seniors and their caregivers. And that it is our mission, what we get up and go to work to do every day, is to provide seniors and their caregivers with access to programs and services so that they can live with choice and dignity in their communities. And what I'll tell you is that what that means to us is that we help people stay in their own homes as long as possible. We help people avoid nursing home placement. And we are really a one-stop shop for services. For those of you in the room, on the other side of this room is the regional headquarters for the Alzheimer's Association. Across the hall is the state veterans offices. We also have within our complex here, Legacy Navigator and the Advanced Care Planning Coalition of Virginia. Our concept is that together we can do more and do better for folks. And so that's why we call this the Center for Aging. And I will conclude this brief overview by saying that our corporate values are courage, trust, respect, results. And that is something we strive to live every day. The Area Plan for Aging Services, which actually is updated every year, really has the purpose of describing what it is that this organization will do with the revenues and other resources that we have based on what we understand to be the needs of older adults and their families in our community. That Area Plan for Aging Services occurs within the context of our overall corporate strategic plan. And why it's important is that Senior Services is really part of the fabric of this community. We are devoted to older people, and it's vital that we maintain our viability as a strategic priority so that we can be here for the next generation of seniors, that we can be the resource for adults and caregivers, because trust me, it's it's a jungle out there. It's really complex to try and figure out what one might need. That we then have a responsibility also as the Area Agency on Aging to plan for the needs of aging, and so that means we have to be a thought leader. What that means is that we have to be able to draw people together and lift folks up into a sort of a conceptual framework so that everybody's content is put forward on the table, and we really, out of that, work together, identify those greatest needs, and then put our shoulders to the wheel to meet those needs. And that's really core, is that we do this in partnership. No one organization can do this alone. So that our strategic goals within that large strategic construct are to maintain, grow, and improve access to services, to improve the effectiveness of our staff and our board, to maintain day-to-day efficiencies, to maintain those efficiencies, and that what we really want to do is ensure that senior services is sustainable over time. And I really want to emphasize right now that this Facebook Live event that we're doing is sort of living out that goal of improving our effectiveness. We have in the room perhaps 20 people. In the region, there are 1.7 million people. In the region, we have over 200,000 senior citizens. And so we have to be able to do as much as we possibly can to inform folks and reach out beyond these four walls. We were established in 1972 as an independent 501c3. I am pleased to report to you that when we think about sustainability, that we are actually the 4th area agency on aging in the United States. The way the government does things, at least the way they used to do things, is that they try things out first. They don't try to surprise you. So what they did following the 1970 White House Conference on Aging was to say, we've got an Older Americans Act, we have a federal administration on aging, we have state offices on aging. Now what we need are local organizations that can be multi-service centers for seniors. And sure enough, what happened was that the 8 jurisdictions in Southampton Roads all came together in collaboration and wrote the proposal, and we got it funded. And so that's how Senior Services of Southeastern Virginia, whose legal name is the Southeastern Virginia Area-Wide Model Program, came to be. So we enjoy the designation of Area Agency on Aging, which is a federal designation and a state designation. And we are governed through a board of directors that has all 8 jurisdictions in Southampton Roads appointing at least 1 member to our board. And in that way, we have not only federal, state, but also local support for what we do. It also gives us access to all of that information that we can synthesize and help to shape our programs. Today, our staff has 98 people on board. I'm delighted that we have not only 98 staff people, but we also have 2 students in the room, both of whom are going to graduate this year. So out there in Facebook land, give these ladies a round of applause. Go on, give it up. We're going to get to a slide where I really wish they had completed their student internship work already, because I would have incorporated it. Among our staff, we have 59 full-time, 39 part-time, and then about 71% of us are female, and about 70% of us are minority. And I'm pleased to report that we're an old people's organization, and we put our money where our mouth is. 47% of us are over the age of 55. I see a lot of geriatric smiles in the room. That's a good thing. Our budget actually in the current fiscal year is about $7.5 million, and the younger people are smiling too, I should say that. But seriously, our budget right now is about $7.5 million. We don't yet have the funding numbers from the federal or state government from the budget that was passed in March. I can tell you from everything that we've been informed officially that this number should be a little bit better for 2019 than it is for 2018. How much a little bit? I don't know, because we won't get our planning numbers until probably the end of this week, which, by the way, is very late. By this time, we usually know kind of what the numbers look like, how much money we're going to have, and that helps to guide our our allocation of those dollars. So take mercy on our CFO, Bridget Miller, who's got to put the budget together very quickly, because we've got to get this up to through our board and up to the state. This is the slide I was mentioning that our students could do a much better job on than I did, because what it is it describes who are the elderly in our region. And so we have over 200,000 people over the age of 60 plus today here in Southampton Roads. What we have to be very mindful is that number is going to grow to over 300,000 people in just the next 10 or 11 years. You stop and think about that. You're going to go from 200,000 old people to 300,000 old people. Okay? I know, because I'm one. All right? And what that is going to do to our population, it's going to mean that 1 in 5 of us here in Southampton Roads is a senior citizen. And what that does is really change the complexion of how we interact. It's going to change the complexion of our industries. It's actually going to put a very large challenge before us to maintain our quality of life. And what it means is, when you got a rising tide lifts all ships. When you've got a lot of folks, you've got a lot of old folks, it means that we're going to have a greater demand on all of our services. So that's why it's really critical that you be critical of what we're doing. In the region, among those 200,000 folks, 35,000 are veterans. That's really important. Not only because that means there may be a lot of veterans who need help, but it means that veterans, by and large, have a base from their experience and a base from their employment as protectors of our country, of a financial security that non-veterans don't have. So it means that there's a real asset there that we can work with. I will tell you, however, that there still is a significant number of people, there are a significant number of people who are poor. And when I say poor, I mean an individual living on an income of somewhere in the neighborhood of $12,000 to $13,000 a year. Think about it. Think about it. $12,000 to $13,000 a year, and your rent is $750. Okay, and your copay at the drugstore is what it is. Okay, and the cost of food is what it is, and the cost of gasoline is now today $2.76 a gallon. Okay, if you have a car. So the pressure on people with low incomes is really great, and part of what we do is to help folks navigate the complex human service systems that are out there to help them with additional benefits that they might be able to get based on their socioeconomic status. The community with the largest number of people in poverty, with the largest percentage of people in poverty is Franklin, and the community with the lowest percentage of people in poverty is Virginia Beach. But don't let that fool you, okay? Because Virginia Beach has got a whole lot of old folks. So you really have to think about the people and not the percentages. It's interesting that over these past several decades, it used to be that it was great to be a guy if you were old. I'm serious. There were 4 women for every one of you if you were a guy. This is true. However, men are living longer. Okay, so that means that it's falling back to sort of 1-to-1. So in our region, it's about equal numbers of men and women who are older. In terms of our racial makeup, we are about 60% white and about 33% black, 4% Asian, and 6% Latino.
But as we think about this surge in aging, what will happen is that older minority people will become a much larger percentage of our population because of advances in healthcare and greater longevity of older minority folks. And then I've mentioned the growth rate. And I know I've spent a lot of time on this data, but it's really important to feel the fact that we're growing as a region in terms of the number of aging population. And in order for us to stay healthy, what really has the greatest impact on that are the social determinants. Medical care is only about 10% of what keeps us healthy. Everybody says, oh, you get sick, you go to the doctor. No, what you want to do is you want to avoid going to the doctor except for the checkups. What that means is that you want to do just what your mother used to tell you to do, all right? Eat right, get exercise, get enough sleep, keep yourself engaged socially, and do for others. It's remarkable. I attended a lecture this morning on brain health, and what the neuropsychologist recommended was cross-training your brain. And it was a combination of just what I said, physical exercise, social engagement, along with intellectual activity. So what we do at Senior Services is work with each person with whom we encounter to address their social needs. We offer over 21 different programs here at Senior Services, and what I can tell you in terms of our 2019 area plan for aging services is that we intend to continue all of those programs. We are truly blessed that the federal government has passed the kind of budget that it's passed. Representative Scott Taylor has a representative in the room, and we have to really show appreciation to our congressional delegations across Virginia because they have unanimously supported the Older Americans Act and funding for aging services. I mean, Virginia is solidly in favor of the kind of work that we do on the national congressional level. And we're really fortunate that way. And so we are able to continue care coordination, care transitions. We're able to continue elder abuse prevention and legal services, and a whole host of community-based services that include transit, Meals on Wheels, the senior centers, adult day health care. One of the roles of the area agency is to be a regional leader or a planner for the needs of older people. And that's been, we're able to continue to do that. We are currently right now involved with 3 different local community planning efforts, one in Virginia Beach, one in Chesapeake, and we're providing real leadership in the city of Franklin. We are consulted by local governments and by other organizations for advice and information, and that's available. And again, if you're joining us from Facebook, we're able to provide data for you as you plan for the development of your communities and your organizations. What our board of directors has identified as our strategic services that need to be expanded in the coming year is advocacy and education that is really focused on caregiver support. 1 in 4 of us are taking care of a family member who can't take care of themselves 100%. That's really critical. And so what we're doing is focusing on the specific needs of caregivers, not only to build service capacity, but also to be the kind of voice for them with our local and state and federal elected officials, because they're at home taking care of mom. They don't have the time or the energy to be that voice. Transportation is another area. 1 in 5 folks in this region do not drive, old folks. Okay? We've got that from verifiable data. And you've got a public transportation system in Southampton roads that's sketchy at best. I see heads shaking, yes, that's right. What we've also discovered is that when we talk about wellness programs or exercise programs, one of the big barriers for people participating is transportation. And so at Senior Services, we do operate a fleet of about 45 vehicles. We do close to 80,000 rides a year, and that is a service that we will continue to grow as best we can in league with a whole variety of other organizations and individuals. We definitely are building out the volunteer capacity on that as well, because again, one organization can't do it all. As we went through our own internal look, and I started off by saying that we're trying to be better at what we do, is we realized that we were not being as good as we could be for our clients. That people sometimes fell through the cracks, or they weren't greeted in a way or treated in a way that really we should. And so we have focused internally on what we call the warm handoff. And so, really, the phone rings, okay, and I send you back to transportation, and you not only have a need for a ride to the doctor, but you've also got a husband, all right, who has a real benefit question, and all I do is get you a ride to the doctor. I haven't really helped you. So we've really been working hard at this warm handoff so that when I talk with you, I get a sense of what you need in a more complete way, and that I know within my organization where to go, and I make sure you get there. Care coordination and care transitions. Families have a great deal of trouble negotiating the human service system, and whether it's hospital, I know we have Centera in the house, or whether it's a daycare center or whatever it may be. It's really, this is not easy work trying to get help for your loved one. And so part of what care coordination does is to help you really identify what your needs are, to help you figure out what your strengths are, and then what you need to supplement what you're doing. And that's an area that we are trying to grow out. The only barrier there, of course, is having enough money to hire enough staff, social workers and nurses, to meet the real demand that's out there. And then that takes us to care transitions. And the problem we're trying to solve, and I think we're helping on this, is that 1 in 5 people today are readmitted to the hospital within 30 days of being discharged when they didn't need to be. Now think about it. Okay, so there are very clear evidence-based practices which we are trained and certified in, where we can reduce your risk from going back into the hospital from 20% to less than 10%. So if I say to you, if you let us talk with you and teach you and coach you, I can drop your risk from 1 in 5 to 1 in 10. Do you think you might voluntarily want to do that? And so we've had a lot of success in doing it. And we're also, by the way, blending that with another evidence-based medications monitoring or medication reconciliation program. And we're seeing really, really interesting results from that. And then our senior centers. Our senior centers are being rebranded. The senior center of yesterday is a wonderful place for socialization. It hasn't been so wonderful a place if you really have personal health goals and personal health outcomes that you want to achieve. It's been good, but it hasn't been as good as it can be. And so we are in process of totally rebranding our wellness centers around the region into much more active and engaged kind of activities. Nutrition is absolutely a part of that. And the issue here is that we want folks to be able to use nutrition to achieve their health. And health is emotional health. Health is not merely the absence of disease. It's a state of emotional, physical, and emotional well-being. And so we're using that World Health Organization definition as well as doing a national search on best practices to rebrand and energize our senior centers around the region. We have added, or we are adding, a range of services for caregivers, I'm pleased to report that in this past year, we have been able to renovate and reopen the Mary Ellen Cox Center for adult daycare in Virginia Beach, and it is in our scope to begin to offer additional services for caregivers there. I've mentioned our warm handoff referral system. As a part of our board's strategic direction to us to improve services to veterans, we have now become qualified as a provider for veterans-directed home and community-based services, and we are taking the final steps to begin to be able to receive referrals from the Veterans Administration. That's huge. There was also a piece of legislation passed, federal legislation last week, called the Choice programs, and we are investigating how that might open up additional opportunities for service to veterans. I will say that we are partners with Mission United, which is out of the United Way of Southampton Roads. And I will say, if for people taking notes, we will give you copies of the slides. So it's like, I taught school for a while, so you don't have to take notes. And there won't be a test at the end, I promise you. But seriously, what the United Way has done is set up something called Mission United, which brings all of veteran service organizations together through a piece of software, so that when the veteran comes to an agency needing housing assistance and employment, job seeking assistance, that veteran is able to be served by multiple organizations by going to only one. We are in the same situation with our Hampton Roads No Wrong Door connectivity project, where we, through grant funding from the Hampton Roads Community Foundation and the Department of Aging and Rehabilitative Services, will be expanding the number of organizations in the region that are on the No Wrong Door system, which is similar to Mission United. And I'm pleased to tell you that Mission United is on the planning team to see how we can really work together. Because part of what makes the world complicated is you get everybody spinning in their own little silos, right? And you're spinning like spinning tops, and then you bounce off of each other. And that's just nuts. So what we're doing is trying to make sure that folks come together better. I mentioned earlier that our total budget, we don't yet know for next year. This looks at the last, looks at 2017 and 2018. You'll see that it's been pretty static over the last couple of years. And where our money goes, or I'm sorry, where our money comes from is largely federal funds. That's for those of you on Facebook, there are two pie charts on the screen, and what it shows is that 50% of the money comes from the federal government, 32% of our money comes from the state government, and the balance comes from a variety of other sources. We are a nonprofit. We do encourage you to send money. It's true. And everybody's smiling now. Nobody's getting their wallets out, so that's not much fun. But seriously, because we're a nonprofit, we do fundraising, and we do have some really critical needs. Because regardless of how much money, remember, you go back to what I said at the beginning, you've got another 100,000 people coming down the pike. You've got 200,000 people now. We're talking about needs, the social determinants. We're talking about people with the kinds of needs where as many as 20% of the folks have a disability who are older today. And you think about the educational levels of folks coming up, and that being a risk factor in terms of not being able to understand what the doctor tells you, when the doctor tells you that. It's on a financial side of things, we really do welcome the support, and I can tell you that our administrative overhead here is at about 5%. So what that means is, if you give us money, it gets put to work to serve the people that you want us to serve. And where it goes in terms of service is a little over 25% goes to transit, about 22% goes to community-based long-term care, about 21% goes into care coordination, care transitions, and about 13% is into our wellness and lifestyle. And so with that, I'll stop and say thank you for your time and attention. Ms. Mason mentioned that we have another 2 weeks to receive your written comments. Or if you want to call up and yell at us, you can do that too. And so on the screen here is, you can send your comments here to the attention of Maxine Scott. And you can either do it by email at mscott@ssseva.org, or you can put them in snail mail at 6350 Center Drive, Suite 101, Norfolk, and that's 23502. So, ladies and gentlemen, that would conclude the presentation. I thank you for your time, and now I guess I should ask Debbie, do we have any questions or comments from Facebook?
Well, we have one gentleman who, we have a lot of things saying great comments, great information. A gentleman named Scott wants to know what the criteria is for any copies.
So we have a Facebook, do you call Facebook callers or Facebook?
Facebook participant.
We have a Facebook participant who says, so what are the qualifications to get into Emmy Cox Center for Adult Daycare? Okay, and I have Madeline Dunstan in the audience, who is the chairman of the board of Emmy Cox. Madeline, would you come up and go Facebook Live and tell us what those are?
What does go Facebook Live mean?
It means come up here and stand next to me.
Stand up and sit here and talk like I've got something to say that's intelligent.
Madeline Dunstan is it the director of education?
Associate director, I'm gerontologist.
She's a gerontologist. Madeline is the associate director for education for the Glennon Center for Geriatrics and Gerontology at the Eastern Virginia Medical School. And so the question is, Madam Chairperson of the Emmy Cox Center, what are the criteria for getting into adult daycare?
Well, first of all, let me say it's nice to be here, and I enjoyed your presentation, and thank the Facebook participant for their question. It's nice to see everybody here supporting and curious about senior services and the array of programs that are provided. I want to first start about Emmy Cox Center. We began the program 42 years ago in a small church out in the Bayside area, and since then we have relocated out into the Little Neck Kings Grant Road area. We have a freestanding building that is owned by the Emmy Cox Center, which is a private not-for-profit entity. We have a new management agreement with Senior Services, as John mentioned, alluded to, the reopening and the revitalization of our adult day services program just this past March. Our daycare service provider is now Prime Plus, and they have brought a new, very active model of adult day services into our building. We continue to be directed by a very active board of directors, being a not-for-profit institution. And so we're very pleased to be able to continue offering our services to the community. With regards to adult day services, it is a daytime program of care that is rendered at the Emmy Cox Center. Our hours are Monday through Friday, 8 to 4, 8 in the morning till 4 in the afternoon. We support family caregivers and other folks who are caring for a loved one in the home who are elderly and who need some kind of supervision and support throughout the course of the day. And that supervision and support can be by way of needing reminders to take medication, assistance with preparing, staging, and eating their meals, helping with personal care, such as help within the bathroom or some other kind of personal care with regards to grooming. We have a very active array of programs and services that are offered that are designed, as John said, to support and maintain wellness. That's just not the physical and the medical wellness, but also nurturing the mind, the body, and the spirit. Our program gives an opportunity for seniors who attend to be able to interact with their peers. We offer supportive services for folks who have some dementia at various stages, as well as folks who do not have dementia and they just need some supervision and support during the day. We have a host of volunteers who come in and provide different kinds of services, whether that's entertainment, musical programs, or other educational programs. We have some nursing oversight that is offered so that people who attend can have medications administered. They can have their medical care plan followed along by our medical professional at the facility. We are licensed by the Department of Social Services here locally, and so we do adhere to all of the local as well as state and federal regulations for such facilities. So we have all the fire, health, and safety standards that we are required to meet to keep our facility as well as the participants safe that are with us. Our cost right now per day is $75, which is about average for the state, maybe slightly below average for the country with regards to the cost of care. And I think if you were to look at the cost of other kinds of services that are out there, if you certainly look at institutional care that's available, you'll be paying much more than $75 a day, although you would be getting 24-hour care. So we are really committed to supporting family caregivers, other caregivers in our community to help keep their loved ones at home with family members by being able to support that endeavor for them. So, are there any other questions?
Thank you. I would just add that in order to qualify for adult daycare, you need to have the kind of needs that Madeline has described. You would also need to have a physical examination and doctors, not a prescription necessarily, but a clean bill of health. You would have to have the ability to pay at this point on a private pay basis, but I know that they are working on becoming certified to accept Medicaid and state and veterans benefits.
And we're working on a sliding fee scale as well to help people who can't pay the full rate.
Right. But there is no age limit. That is to say, you don't have to be a certain minimum age. But if you're 18-year-old, you really don't want to go hang out with a bunch of old people, I can tell you.
I don't know, I did when I was that age, it was kind of fun.
Yes, ma'am. We have another Facebook question.
We have another Facebook
Thank you.
question. Seniors in the community are asking about transportation for seniors who want to go shopping and participate in activities in the community. Can senior services help with this need?
The question is, can senior services help with transportation needs, not only to go to the doctor, but for other kinds of transit, like going shopping and going on social outings? The answer to that is yes, but. And the but is we have actually a very limited capacity when you look at the demand. And so in order to schedule a medical ride, which is really our first priority, what you need to do is to call us at 461-9481 and ask for transit. And then the folks back in transit will schedule your appointment for you if it's at all possible. If you want to go to one of those wellness centers that we mentioned earlier, then you can connect with the wellness center or you can connect with our resource specialists. And if you have need of a ride to the center, then that gets arranged through the center, but scheduled out through our transit unit. In terms of those more social outings, like going shopping and that kind of thing, we do operate iRide, which is a sort of like public transit. It's a fixed route, and we have an iRide in the Ward's Corner of Norfolk, in Franklin, Virginia, and in the Smithfield area. And so there you can use that service for any destination that you might want to go to. And we do stop at supermarkets and pharmacies. In Franklin, we actually stop at the library as well.
John, we have no questions from our Facebook audience. So someone, Kathy, out in our Facebook audience, wants to know, does iRide provide rides to seniors that need to get to the MEPOC Center, and does insurance cover any care at MEPOCs?
Okay, the answer is, does iRide provide rides? iRide to MEPOCs, yes. So again, you would call in here 461-9481 and then ask for transit, and then you could schedule it that way. The other question is does insurance help to pay for that? At this point, we don't accept Medicaid insurances at Senior Services. So I think the answer to that one is no, unfortunately.
I would qualify that and say that if an individual has a long-term care insurance policy, that oftentimes those benefits can be sprung to support the person who goes to daycare, but it will depend on the policy.
So Ms. Dunstan just added that if you have long-term care insurance that has a transportation benefit, that definitely is something that we can look into and see if we can get it to work for you to get to where you need to go.
But it also may have a daycare benefit as well.
And it might even have a daycare benefit.
Okay, Scott out in our audience wants to know, if a senior needs to have their Medicare or Medicaid benefits checked out, how can they do this?
Scott's a very inquisitive fellow. So the question from Scott is, if somebody needs their benefits checked out, can we help with that? The answer is yes. We have a benefits counseling division at Senior Services, which not only is here at our location at 6350 Center Drive, but also we go to you. So we hold regular new to Medicare training sessions for folks that are newly coming into enjoying their old age. And then individual folks who have questions about Medicaid, we can coach you through the process. This stuff is not easy. We also have trained volunteers, so we're able to help you over the phone, over the internet, or over the desk.
So Iris out there in Facebook land wants to know, seniors in the community want to know, are there any plans for Senior Services to serve seniors under 60? Many 50 to 65-year-old individuals have needs and have difficulty finding services.
So Iris in Facebook land says, what about those people that aren't yet 60 but have needs and they're 50? Well, here's the thing. Right now, 60 is the age requirement for Older Americans Act. For IRIDE in Franklin and Smithfield, you can be any age. For Norfolk, you have to be 60. The question is, do we have plans? And the answer is, for some of our services, we can serve people under the age of 60, like the Senior Companion Program. But in terms of Meals on Wheels, and in benefits counseling, I see Bonnie Dozier, our benefits counseling team leader, saying, yes, we can, yes, we can. And in fact, 1/3 of all Medicare beneficiaries are under the age of 65, just by the by. So, but in terms of an expansive set of services offered by Senior Services, the answer is no, we don't have plans to really expand to less than 60. However, we can link you to those services. This idea of the No Wrong Door Connectivity Project, or Mission United, or the homeless HMIS system, part of our job is to link you to the services that you may need, even if we don't provide them for you. And it looks like Facebook is heating up.
We have a lot of participants. So they want to know, seniors in the community want to know about nutrition help. Can our wellness department help with that?
The question is, can we help with people that need nutrition help? The answer to that one is yes, we can. Okay, we can help in probably 3 different ways. We do the Meals on Wheels. And so if you are in need of Meals on Wheels, or your family member is, then you come in through that care coordination group. Our care coordinators will meet with you, and I'm looking at care coordinators in the office going, okay, I think he's got it right. Have I got it right? Okay, good. So really, we begin to get to know you. We do what they call person-centered practice, which means that there are no rubber stamps. So we really get to know you and what your needs are, and then we come to your home at your invitation. And in that process, called an assessment, we identify what it is you truly need, and then we help you to develop the care plan. In terms of nutrition, the meals that we provide they'll give you 1/3 of what you need to eat every day. It's called the RDA. It's not 3 meals a day, it's largely 1 meal a day. And we have different ways that those get delivered to you. that would be explained with you by your care coordinator. The second way is that we have nutrition centers, or those wellness centers around the region, and we can provide, I guess on any given day, like today, we probably have somewhere around 350, 400 people coming to eat at these different centers. We partner. You can remember, go up front, this collaboration stuff. We really partner with other organizations, and we are hosted. We're blessed to have those federal dollars coming in to pay for the food, but we really rely on our partners to actually create the environment where it occurs. And that might be a church, it might be a community center. We are currently in the process of renovating an historic African American high school in Franklin. When that's up and running, we will have a really nifty center in Franklin called the Hayden Village Center. And then the third way that we can help with your nutrition needs is we have a registered dietitian on staff. And she's very clever. So that if you have an individual need, then we can help you with that counseling. I mean, if you're diagnosed with a particular condition where you need dietary advice, we can help with that. And then we do group. She does a really nice thing with chocolate, I can tell you, it's great. And she does a really nifty thing with snacks. So, and she tells you how to stay healthy when you eat chocolate, which, so I would say we definitely can help with chocolate.
So we have another question. How can seniors out in the community looking for senior center programs find those?
Okay, the question is, how do you find senior center programs at senior centers if you're a senior? The simplest way is, well, there's two ways. 461-9481 and ask for the resource specialist. And if you have access to the internet, you can go on our website, and a list of all of the senior centers in the region is on our website. And that's www.ssseva.org. Go ahead, Facebook.
We're very busy here. So, one of our participants says that he's heard about our senior companion program, wants to know how does it work, and if you'd like to volunteer, how can you do that?
Oh, wow. Robin happens to be our senior companion. But wait, there's more. No, seriously, Robin is a senior companion coordinator. Could you give us a short answer to that question?
Yes. Thank you, hi, out there in Facebook land. Our Senior Companion Program is a group of senior volunteers aged 55 and older who help other seniors 60 and older in their home. They visit regularly, and about 85% of their role is to provide companionship, but many of the people do need a little bit of help, so we ask that you prepare some light meals, maybe help with some light housework, and maybe some outings if you as a volunteer are able to drive and get about. And you may reach me as well at 461-9481, extension 113, and I'll be glad to talk a little more with you. Thank you.
Nicely done. Okay.
And just a good comment for you all. Jane out in the community just wants to tell us that this is really helpful information and what a great job, and she hopes she'll do it again.
Very nice, thank you. So we just got a compliment from Jane. And the Facebook has been dominated. I guess I wonder. I was going to say from folks here in the hearing, do you have questions or comments? Well, let me ask you a question. We kind of laid out what our priorities are. Do those make sense to you? Let me ask it a different way. What did we miss?
Perhaps individuals with disabilities who aren't yet 60.
Okay. So Mark Bragg is with
Department for the Blind.
Department for the Blind, and he raises the question, perhaps we missed people with disabilities who
Are not yet 60.
are not yet 60.
Transportation is one of the bigger issues.
So Mark is, you want to come up and just say it? He doesn't want to. No, but seriously, Mark is saying the transit is one of the major issues for people who can't drive, who are younger. Yeah.
Mark, we are able to provide meals to disabled dependents in the home under our Meals on Wheels program. So there's a dependent disabled child in the home, and we can qualify them under the senior.
Good. And Jessica is one of our care coordinators who, for folks who might not have heard that, we are able to provide Meals on Wheels for family members who are younger, who have disabilities,
And a dependent, yes.
and are dependent on the older person living in their home.
Yes.
Good. Other questions? Facebook question?
So, my parents are moving to this area, and senior services help me with information that I need to know and resources.
Wow, my parents are moving to the area. Can senior services help for information? That's a really great question. I say that because we play pitch and catch with area agencies all over the United States. What I would say to the Facebook participant is go find the area agency on aging in your area where you are, make contact with them, and talk with them about the relocation of your parents. If it's really helpful, if when your parents arrive, we've got a set of information to help them get settled here in the region. You come to you don't have a doctor, you don't know where things are. If you have you've got to get help with your insurance to get, if you're out of state, coming into a new state. We can help with all of those things, and it really and I personally have taken calls from families right after the holidays where they've gone to visit their parents in another state, and they come back and they're just really freaked out because mom is not doing well. What do I do? We can help long distance caregivers connect with services in other places. So,
I have a question.
say again?
We have a half hour left, so please, any questions on this?
I have a question.
Yes, ma'am.
For a referral, because I've been told that, so I work with Gen Care Medical Center, and sometimes we often call for referrals for our patients. I was told that you all had made a change and that the individual, the patient, would have to call or a family member if they had a need for service themselves. Is that accurate?
I have to say that no, that's not accurate. That the comment was a question as to whether someone would have to call on behalf of the family member, or could the family member call themselves. The family member can absolutely call themselves. If there is, it's helpful if there's another family member involved, or if the person who needs to call has trouble communicating. Yeah, having somebody to be there with them or for them is helpful. But we want people to call.
Right. So as a professional for myself, if I was calling for someone for that referral, I was told that the individual or family member of that individual would have to be the one to call to make the referral.
I'm looking at Director for the Center for Aging, Brad Lasnick. And so, come on up, Brad. Take me off the hot seat, Brad.
So like for most good questions, the answer is yes or no. Hi, how are you doing? Long time no see. So any professional can start the referral. So you can call us, give the information, and then our resource specialist will call the individual because there is a lot of information that's needed in order to qualify somebody for certain services. So we'll take the call from anybody. So I don't know if it's a service that perhaps like they needed the income or insurance and those kinds of things. But we do take calls from anybody to start it, because what we do is we put the name in the system. And again, whether the family wants to call us or we will call them and say, you've been referred and we'd like to talk with you and find out what kind of services you need, what kind of options there might be. Does that answer it?
It does. That was originally, so I don't know why that stopped like midstream, but once I was calling, and it was usually for like Meals on Wheels, I was told that the person would have to call themselves or family member. So at first it was, I was doing it and there was no problem, then they were saying you all had going through some changes and that the person needed to call.
Right, could you talk?
I'm not
could you
familiar
talk
with
up?
this.
Facebook
Okay.
Land is asking if you could talk
I'm sorry,
louder.
I'm sorry.
Facebook Land is asking if you could talk louder.
Okay. I'm done.
Well, no, you're not, because we have another question. So
Okay, sure.
someone is saying that, my mom is really ready to, we can't care for her anymore in the home without some support. How do we make a decision whether it's time to have to place her in assisted living? Is there someone that can help us with the ins and outs of that, pros and cons?
That's a great question. So we have certified options counselors on our staff. We have a bunch of them in the room right now. So if you were to call us at 461-9481 and speak to our resource specialist, they will assign you to one of our options counselors who will come out, do an assessment, and walk you through what your options are, because we're very person-centered here at Senior Services. This is your plan, it's not our plan. We don't come in and tell you what to do. We tell you what options there are in the community and let you choose what's the best option for you and your family. So yes, we definitely can do that.
Okay, thank you.
Okay. I think I'll take back.
Excuse me, Sheila, before you, do you mind if I address, the lady's question from Gen Care? When I make referrals, I call on three-way calling and I have the client or their caregiver on the phone with me. And even if I have to leave a message, I say, oh, Miss Jones, are you still on the line with me? And she says yes, and this way the agency knows that they have my permission, or she has, we have information to exchange, and it makes it easier, and that might help smooth things out when you're making that initial referral.
And sometimes I do, if I have the patient there with me, I do call with them, but that doesn't always, it's not always the case.
Sure.
Yeah.
Do we have
Sheila,
another?
We do. We have another question, and it sort of goes to what you all were talking about before. I have concerns about a resident in my apartment complex. I'm not a family member, but I'm very concerned. I don't know their family members. Can I contact Senior Services to get help for that person?
Yeah, let me take that one. That's a really good one. The Facebook participant has concerns about someone who lives in her apartment complex. She doesn't know if this person even has family, and her question is, what do I do? You certainly can call us at Senior Services at that number 461-9481, ask to speak to the resource specialist, and we can talk with you about the situation and get a better sense of what you're seeing and what you're feeling. If this person's situation is such that you believe that they are not taking care of themselves, self-neglect, or if you suspect that by being isolated, they're at risk of being taken advantage of, then that would be an adult protective services referral. In this complex system, there's something called adult protective services, and it's their responsibility under the law to investigate complaints, they're called, or referrals for situations that might result in a person being abused, having self-neglect, being financially exploited, and so they've got the authority that actually, as Area Agency on Aging Options Counselors, we don't have. But absolutely, call us. Let's talk this thing over so that we can get a better sense of the right way to go forward. I will say that if you're living in a senior citizens apartment complex, then you've got a building manager. And so if you're worried about the lady in 302, then you need to go talk to your building manager. You're not just being a nosy neighbor. Right? And a lot of times it's either our pride or our worriment that gets in front of us, and you can't let that. If somebody needs help, you got to give them help. So that's the answer.
One more question.
Yes.
I think my dad could use Meals on Wheels. Are there qualifications?
I think my dad needs Meals on Wheels. Are there qualifications? Yes. What? And the qualifications are, you just. Well, let me bring Brad back up.
In order to get Meals on Wheels, you have to be 60 or older, or there was mentioned earlier, if there is a disabled dependent in the home as well, they might qualify. Has to be homebound according to the DAR's definition, so that means that it's not driving to, wherever it is they go every day. Literally have to be homebound. And what else am I missing? Options counselors, it's the 60 and older, and unable to prepare their own meals for whatever reason. So those are the three primary ones. We do recommend that you call in, talk to one of the resource specialists or one of our options counselors, because sometimes, there are some shades of gray in there that we can try to qualify, even if it's a short term. If somebody's coming out of the hospital after surgery, they're maybe only going to be disabled for a month or two, then we can probably qualify them for the meals. So we would recommend that you at least call in and talk with us to see whether we could qualify you for the Meals on Wheels program.
Is there a charge for the meals?
Is there a charge for the meal? We do not charge for the meals because it's federal funding, but we do ask for donations to help offset the cost so that we can serve a larger number of people.
Okay. Let me say this. In John's presentation, you saw all these statistics. We have a whole group of partners, and we look for feedback, but there is nothing like this public hearing where we actually get your feedback. The area plan is built on a perspective of the community, and so the public hearing is for the community. And again, if you know other people that you believe should be present, have input, please let us know. You have 2 more weeks for written comments to be submitted to Maxine for additional information that we can provide in our report. But again, I'd like to thank you for coming, those who are here. I'd like to thank our Facebook participants. We've got the bulk of your questions. And again, we have our website, and we will continue to communicate with the community and hold this forum every year. And it's either in May and June, depending on the area report schedule. And since you have attended this year, you certainly become a priority to be on the attendance list for next year. So again, I adjourn the 2018 Senior Service of Southeastern Virginia public hearing, and I wish you a great afternoon. Thank you.
And would you give it up for Neely Kehan, who's been doing this technology chart?
Congratulations, if I see you again.
Yeah, thanks for being here.
How
And my wife.
Well, actually,